Sciatica. What is sciatica? What does sciatica pain feel like? Can sciatica occur down both legs? Does sciatica occur suddenly, or does it take time to develop? What are the risk factors for sciatica? What causes sciatica? You need to know all answers, and more. I advise you to watch the full video. Let's start. Sciatica pain is caused by irritation, inflammation, pinching, or compression of a nerve in the lower back. The most common cause is a herniated or slipped disc that causes pressure on the nerve root. Most people with sciatica get better on their own with time and self-care treatments. What is sciatica? Sciatica is nerve pain from an injury or irritation to the sciatic nerve, which originates in your buttock or gluteal area. The sciatic nerve is the longest and thickest, almost finger-width, nerve in the body. What does sciatica pain feel like? People describe sciatica pain in different ways, depending on its cause. Some people describe the pain as sharp, shooting, or jolts of pain. Others describe this pain as burning, electric, or stabbing. Can sciatica occur down both legs? Sciatica usually affects only one leg at a time. However, it's possible for sciatica to occur in both legs. It's simply a matter of where the nerve is being pinched along the spinal column. Does sciatica occur suddenly, or does it take time to develop? Sciatica can come on suddenly or gradually. It depends on the cause. A disc herniation can cause sudden pain. Arthritis in the spine develops slowly over time. What are the risk factors for sciatica? You are at greater risk of sciatica if you have an injury, a previous injury. An injury to your lower back or spine puts you at greater risk for sciatica. Life. With normal aging comes a natural wearing down of bone tissue and discs in your spine. Normal aging can put your nerves at risk of being injured or pinched by the changes and shifts in bone, discs, and ligaments. Are overweight, your spine is like a vertical crane. Your muscles are the counterweights. Lack a strong core, your core are the muscles of your back and abdomen. The stronger your core, the more support you'll have for your lower back. Have an active, physical job. Jobs that require heavy lifting may increase your risk of low back problems, and use of your back or jobs with prolonged sitting may increase your risk of low back problems. Lack of proper posture in the weight room. Even if you are physically fit and active, you can still be prone to sciatica if you don't follow proper body form during weightlifting or other strength training exercises. Have diabetes. Diabetes increases your chance of nerve damage, which increases your chance of sciatica. Have osteoarthritis. Osteoarthritis can cause damage to your spine and put nerves at risk of injury. What causes sciatica? Sciatica can be caused by several different medical conditions including a herniated or slipped disc that causes pressure on a nerve root. This is the most common cause of sciatica. About 1% to 5% of all people in the US will have a slipped disc at one point in their lives. Discs are the cushioning pads between each vertebra of the spine. Pressure from vertebrae can cause the gel-like center of a disc to bulge, herniate, through a weakness in its outer wall. When a herniated disc happens to a vertebra in your lower back, it can press on the sciatic nerve. Degenerative disc disease is the natural wear down of the discs between vertebrae of the spine. The wearing down of the discs shortens their height and leads to the nerve passageways becoming narrower, spinal stenosis. Spinal stenosis can pinch the sciatic nerve roots as they leave the spine. Spinal stenosis is the abnormal narrowing of the spinal canal. This narrowing reduces the available space for the spinal cord and nerves. What are the symptoms of sciatica? The symptoms of sciatica include moderate to severe pain in the lower back, buttock, and down your leg. Numbness or weakness in your lower back, buttock, leg, or feet. Pain that worsens with movement, loss of movement. Pins and needles feeling in your legs, toes, or feet. Loss of bowel and bladder control due to cauda equina. How is sciatica treated? The goal of treatment is to decrease your pain and increase your mobility. Depending on the cause, many cases of sciatica go away over time with some simple self-care treatments. Self-care treatments include applying ice and/or hot packs, taking over-the-counter medicines, performing gentle stretches. Can sciatica be prevented? Maintain good posture. Don't smoke. Maintain a healthy weight. Exercise regularly. Choose physical activities least likely to hurt your back. Keep yourself safe from falls. If this video helped with some information, don't forget to subscribe. Thank you for watching.